Healthcare services in the United States. The Affordable Care Act requires all health plans in the individual insurance market and small group market to cover services in the following 10 categories: ambulatory services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse services and treatment, prescription drug coverage, rehabilitative services, laboratory services, preventive and wellness services, and pediatric services. Medicaid provides health insurance to the impoverished, and coverage varies state to state. States are required by law to provide basic mandatory benefits such as inpatient and outpatient services, laboratory and x-ray services, physician services, home health services, and transportation to medical care. Many services are optional and vary state to state, such as prescription drugs, eyeglasses, dental services, and chiropractic care.